Welcome to the podcast and the video shoot of the Talk with the Doc. And today in our studio, we have a specialist in sleep. This is Dr. Ravi, and he is a sleep expert and been practicing for more than 20 years. He serves in DFW areas and helped countless people to sleep better without snoring and without disturbing the partner. Okay, so today we're going to talk about a lot of topics. We're going to cover a lot of topics about the sleep apnea, how it affects, what are the complications, how we can take care of it, what you can do about it. But without further ado, I'm going to give it to Dr. Ravi. I'm going to tell Dr. Ravi to introduce himself so you can hear from him as well. So thank you so much, Dr. Ravi, for coming, and tell us a little bit about you so our viewers can understand like how we can help them.
Well, thank you very much for having me here. I'm basically trained in internal medicine, as well as I've done a fellowship or 1 year of training in sleep disorders.
Okay.
And I also have a very keen interest in all basic sleep disorders, but I have a clinical interest in sleep apnea.
And I think I heard, like I was reading an article where you did a lot of research on this too. You have published some articles, you have done a lot of research on sleep apnea and how it affects people and all.
Correct. And it basically affects you from head to toe.
Okay.
And starting from your brain, your eyes, your heart, your liver, and your joints. The new interesting finding is that they're finding that people who have sleep apnea or an airway problem may have cervical posture problems as well.
Okay.
Which may transmit to the lower spine structures later on.
So tell us first of all, because many times people don't understand the term sleep apnea. People have heard about it, but they don't really understand what is sleep apnea. So tell us, what is sleep apnea?
Right. So sleep apnea is basically you stop breathing in the middle of the night.
Okay.
And apnea is you have complete stop in airflow. Hypopnea is when you have decreased airflow.
Okay.
So what happens is when you don't breathe, okay, that will cause chronic problems later on. But one of the other things that happens is you don't breathe, and then you wake up and you have these repetitive events through the night, and that's one of the reasons that you're tired the next day.
Okay.
Because you don't get the sleep that you require.
Okay. So what are how the person can tell that they have a sleep apnea? Is there any symptoms or any signs that should be looking for?
Sure. So usually if they have a significant problem, they will know because they're tired, they complain of fatigue. The chronic or the classic symptoms are loud snoring, choking, or gasping. The bed partner or the spouse will say, hey, there's something wrong, usually. And a lot of men come in because their wives pick it up.
Okay.
And so you're tired. If you're on more than 3 blood pressure pills, or what they call it resistant hypertension.
Okay.
It's also associated with many other medical problems. So some of the complications of sleep apnea are, one way to look at it is, what are the symptoms that you have?
Okay.
And that could be, as you said, could be headaches, fatigue, tiredness, sleepiness, or excessive daytime sleepiness, things like that. Dry mouth, or my mouth is open, or loud snoring. Sometimes the spouse will say he snores like a freight train. I've heard that many times.
Yes.
So those are some of the classic signs. And then after that is the complications that you have. So you can have hypertension, it can be associated with diabetes, history of stroke, heart attack, atrial fibrillation, and heart failure are 2 big cardiac factors as well.
Okay.
And the most common category, broad category, is actually neurologic. And people can have memory problems, or they can even have silent strokes.
Oh, wow.
And not even be aware of it.
Yeah, I came across the article where I looked for all the side effects, or not side effect, but more like, the sleep apnea can cause this kind of problems. And I was surprised to read all those major diagnoses like a stroke and heart attack and all those things. So if someone is suffering from the sleep apnea, and let's say if they have some symptoms and they go without doing anything about it, so that can lead to this kind of problems?
Yes, yes.
Okay.
And then chronic problems, it can progress to a heart attack or a stroke.
Okay. So what are the signs, like when they should seek the expert? So what is the, like when they understand some of the symptoms they have it, when they should reach out to you, like expert like you? So what are the signs that should, hey, you know what, I need to pick up the phone and call some expert to help me? So what are the time they should be reaching out to you?
Okay. So if they're tired, okay, or they're snoring loudly, okay, and a lot of times where people present different ways. They have headaches or they have resistant hypertension. They're on a lot of blood pressure pills. Usually, most patients are smart enough to say, hey, there's something wrong. I need to go see someone, okay?
Okay.
So what I recommend is that every patient see their PCP routinely,
Okay.
and discuss at minimum at an annual visit how they sleep.
Okay.
Okay.
That's a good point.
Okay. And you should use your PCP or primary care doctor, to bounce things off or say, hey, this is going on. What do you think? That's one. The other professional you should also see is you should see your general dentist twice a year and discuss if you have problems with your teeth, TMJ dysfunction, your grinding. That's called bruxism. That's another symptom. All those things with your dentist. And finally, you should also see an eye specialist on an annual basis. Okay.
Okay.
And they have newer technology where they can pick up things. So, like if somebody's older and they have glaucoma, okay, and they can use other imaging like OCT or optical coherence tomography to look into the back of the eye and say, hey, here's some conditions associated with sleep apnea. So those are the approaches. And then finally, most patients are intelligent. We can get on the internet, Google whatever it is, and if they feel that something is not right, come in and see a sleep specialist.
Okay.
And or go through the PCP. But any one of those symptoms I mentioned.
Okay.
And these are just with sleep apnea. There's narcolepsy, there's parasomnias, there's many other sleep disorders also.
Yeah, so, but this one is just the one category, but there are more things
You're right.
happening as well, can be happening as well. So, what are the things they can do to help their sleep apnea? Is there anything that they can do themselves to help the sleep apnea?
Sure. So I think with sleep apnea, it's a multifactorial problem. It could be craniofacial, it could be related to your weight, it could be related to genetics, many different things. So the first step is a proper diagnosis. Okay. Then after the diagnosis, patient needs a workup to figure out why they have sleep apnea. Okay. So, for example, somebody could have really bad allergies from childhood and then have sleep apnea because they have a significantly deviated septum, or they played soccer and they got hit by a ball and they never got their nose fixed. Or it could be something more complicated, or they have a craniofacial issue or a jaw issue, plus they're overweight or something like that. So really what the physician needs to do is make an assessment, say these are the list of things that could be contributing to your sleep apnea.
Got it. So in simple term, if I can say that if they have fatigue, they're feeling tired in the day, if they're snoring in the night, so even with these basic symptoms, they need to talk with their primary physician on a routine checkup that, hey, these are the symptoms, what should I do? And then they can refer to the expert like you, and then you can do further diagnosis, what's going on.
Or the other thing that they could do is they can get on the internet and take a stop. It's called a stop bang questionnaire.
Okay.
And then it'll tell you what the score is, and what it's low, moderate, or high risk for sleep apnea.
Okay.
So if they're at moderate or high, they could consider it or discuss it with their PCP.
Okay.
The other one is called the EPOR sleepiness scale, which a lot of insurance companies want to see.
Okay.
So, and then this could be easily discussed with the PCP.
Okay.
Or they can come in and see a sleep specialist.
So I'll put the link for those questionnaires at the end of the video, so in that way people can access as well. Okay. All right. So two common questions that I ask many times, or I've been asked many times by the patients: how many hours of sleep is good sleep?
That's an excellent question. So it's now recommended between 7 to 9 hours.
Okay.
And I tell patients to try to shoot for 8. And everybody's different. Everybody's body's different. So, plus or minus a little wiggle room, whatever works for them. If they're sleeping 7 hours and every day they're tired, then maybe they need to increase it to 7.5 or 8.
Okay.
Okay, and so forth. If they sleep 7 hours and they have a very productive day and they're not tired or sleepy, then that's what it is for them.
So that brings me one of the topic, because I talk with a lot of patients, and many times I ask them, okay, how many hours you sleep? And this is very common answer I get. 4 to 5 hours I sleep. And my next question is, why? And they said, I don't know, just wake up in the middle of the night. Okay. Then my question is, the pain wake you up? Because I'm a physical therapist, so my thinking goes on the pain side. And said, no, not the pain. I said, then what wakes you up? I don't know. So would that be considered? It could be. It could be associated with the sleep apnea, if something like this. I know it's very, very basic information, so.
Yeah, it could. And a lot of women also, they feel that it's their menopause that's waking them up, but it could actually be sleep apnea.
Sleep apnea.
So it could be anything, and these are two, somebody who has a joint or a spine problem or pain from them, it's possibly independent of sleep apnea.
Okay.
Okay. Now, unless it's the actual pain that's waking them up.
Yeah. So that's why I ask all the questions, like what, like really pain
you
or.
could have two separate problems. One is the pain,
and
one is the apnea. So.
Okay. Like what about the CPAP? Because most of the patients are familiar with the CPAP. So whenever they have some kind of sleep apnea and they use the CPAP, but that becomes kind of interfering in their sleep. So what are the tips that you can tell those people? Because I know with many of my patients, they use the CPAP too. So is there any convenient way to wear it, or any other options? Like considering, like, that okay, they have a difficulty wearing all night long. So what are the options for that? Like, is there like any other solution, or the CPAP is the, like, it has to be used?
There's multiple solutions.
Okay.
And at the end of the day, it's whatever's in the best interest of the patient and what works. My personal opinion is CPAP is non-invasive.
Okay.
If you have true craniofacial sleep apnea and you have a high arch palate and you have a obstructed nasal passage, you're going to have a hard time with CPAP.
Okay.
But what you should do is go to a sleep specialist, get worked up, and it's also a multidisciplinary approach. So as a sleep doctor, we can send you to ENT, we can do imaging, all sorts of things. If you're congested, we can give you nasal steroids, all sorts of new things.
Okay.
Okay. But what's also equally important is the type of mask that people have is essentially very important, and also to work with a good company, a durable medical equipment company, where you can try different masks or whatever, and then we need to look at the data that's collected and say, hey, why are you sleeping really well, or why are you not sleeping really well? All that has to be reviewed, and it's a constant assessment.
Okay.
It's not, you got sleep apnea, now here's a CPAP, now go away. Okay, it's never like that.
Okay.
But a lot of patients, the first thing you should say is, hey, it's not working for me, and you should work with the doctor to stabilize it from CPAP.
Okay.
And there's also dental therapy that can be used in addition to CPAP therapy to improve the outcome.
Okay. Also, I came across the article, I think, did the sleep apnea lead to the postural issue? Because I know it's not very much detailed research topic, but I heard that because we deal a lot with the postural issues, we have a forward head posture, we have like a cervical spine, the rounded back and everything. But I also heard like sleep apnea can cause a problem with the posture. So is there study going on for that?
Oh, there's multiple people doing research on that. This is a relatively new research area. I mean, depending on who you talk to. But there's an association with sleep apnea, and it's called forward head posture, where your head is out this way.
Okay.
So that's a particular interest of mine.
Okay.
And also, so when you see it in the future, a dentist or a sleep doctor specializing or interested in sleep disorders or sleep apnea, you'll expect to see them get an x-ray of the cervical spine also.
Okay.
As a part of the workup, okay? And so we believe that, when there's an airway problem, to increase the airflow or improve the airway, people come up with a forward head posture.
Okay.
And if you fix the underlying problem, hopefully the postural problem will correct.
Okay, so that really interesting topic, because we see a lot of, and especially after COVID, because people work on the computer, they have a rounded shoulder, their posture is compromised, forward head posture. So when we see the patient with the neck pain, the first thing we do is we do the assessment, is it causing by the issue with the spinal alignment, or is it the issue with the tight muscles? Is it like a flexibility issue, mobility issue? But I think I need to also consider, when we're doing the assessment, how's their sleeping, how's their breathing, because as you were saying, that can lead to a postural problem. So not only structural and muscle, but also the airway can cause that postural issue as well. Right. So that's very interesting topic. So we need to, I think everybody, all the physical therapists and dentists and everybody, they need to understand, because see, when the patient comes, they don't know what causing them. They're coming for a solution. But if you don't do the thorough assessment, what causing it, that can lead to a lot of unnecessary treatments.
Sure.
So when the patient comes to you, for the sleep apnea, what is your approach? How do you start the assessment or treatment?
Excellent question. So always, it's a history and physical. We have a questionnaire and that they fill out, so we get the history of what's going on. Then a physical exam, and then most patients, I tell everybody to get their thyroid and other labs from their primary care doctor to make sure that those are okay. Okay. And then we do a sleep study, and the sleep study will tell you. If we're focused now, the sleep study will pick up other sleep disorders also. But if we're talking about sleep apnea, it'll pick up whether or not they have sleep apnea. And then if they do, that's the first step, and we can treat them with CPAP or a dental device or so forth. But we also do something to work the patient up from a craniofacial standpoint, which I've called pranapedics. Okay. And then we can try to ascertain what the problems are. Okay. And then in conjunction with work with a dental professional. Okay. To get the patient fixed. Now, one approach is that they can wear a mandibular advancement device, which is which a lot of dentists do, or we can do upper airway modeling, but that's a little more complicated, and it's 2 years of treatment. Okay. And that's in case by case, individual by individual.
Okay. All right. What about the positioning? When they sleep in the night, is there any position that can help them to sleep better? If someone has a sleep apnea, is there any particular position that helps them?
Yes. And then it comes down to if they have sleep apnea, whether they're on CPAP or not. Yes. And so I generally recommend sleeping on the back. Okay. But if you have untreated sleep apnea, that might not work. And so the first thing to do is get the sleep apnea treated. Yes. Or you sleep on your side, or you can try elevating the head.
Okay. Okay. All right. So now being physical therapist, my always brain goes towards the exercise, postural correction and all. Do the regular physical activities, do the staying healthy, weight management helps with the sleep apnea?
Yes, absolutely. You can also, it's good to be healthy, maintain your weight for all medical conditions.
That's true.
Not just sleep
Ju-
apnea.
yeah, that's true.
And another new, very interesting topic that has popped up is myofunctional therapy, where you learn exercises for the tongue.
Okay.
And retrain the tongue.
Okay.
So the tongue could be considered one of the most important muscles in the body. Depends on who you talk to. Other people may say it's the diaphragm and,
Yeah.
and so forth, okay? So tongue is very important. You can do neck exercises. You can do yoga,
Okay.
all sorts of things.
Okay.
So in conjunction to losing abdominal weight or just weight in general, you can also focus on.
Yep, the exercise for your like neck posture, tongue, and all those things.
Yes.
Got it. So if someone wants to reach out to you, for any kind of need, or like they wanted to do the assessment to find out how they can reach out to you.
They can either come to my website and go to breathesleeplive.com,
Okay.
or they can call us at our office at 469-501-2224
All right.
and make an appointment.
Sounds good. Thank you so much for watching. And this is Dr. Sanket, physical therapist. We are at Shore Care Therapy and Wellness, and you can reach out to us and we can refer it to you as well. So if you have any doubt, if you're a patient here, definitely we can help you. If you have any of those symptoms that we discussed today, just give us a call and set up your appointment today. Our phone number is 469-212-8888. But thank you so much, Dr. Ravi, for coming and providing all the information. I hope all the viewers will find this information very, very informative, and they will take the action, because if you don't act on it, it can get worse. Because many times what I notice, people ignore until it becomes something that stops them. Like if they're waking up and they can't sleep, don't wait till that time, Because I always tell people that if the issue is minor, we can fix quicker. But if it gets worse over the time, that's a problem. So don't hesitate. Normally, just give us a call, or you can call directly as the number mentioned, and set up your appointment. All right. Thank you so much.